Hi guys, this is Ada Ojain from Med Lectures Express presenting to you our very first video on clinical pearls of the day. This is going to be a regular series on our channel, and today's topic is on beta blocker use in hypertension. Indication for beta blockers include the following: heart failure, coronary artery disease, cardiac arrhythmia, essential tremors, hypertension, myocardial infarction, and migraine prophylaxis. There are other uses that are not mentioned. The following are the different formulations of beta blockers. Mechanism of action for beta blockers. Beta blockers work by antagonizing B adrenergic receptors, which are tethered to the G protein-coupled receptor family. The G-coupled protein receptor family are paramount to pharmacology because it's a drug target protein, and they're highly instrumental in the treatment of various diseases. Beta blockers bind to B1 and B2 receptors. They provide a blockade of circulating or endogenous catecholamines such as epinephrine and norepinephrine, which are hormones that exert automatic effect or automaticity on the heart, and also has various functions on other organs. Main action of beta blockers is that it decreases contractility, they inhibit renin secretion, they also decrease sympathetic outflow, which has a profound effect on blood pressure. The diagram illustrated just gives a brief overview of the mechanism of action for propranolol. The arrows that are broken illustrates the indirect effect, and the straight arrows that are not broken are the direct effects of propranolol. These diagrams were adapted from GrepMed and Science Direct. The diagram on your left gives you an overview of adrenergic receptors, but we're going to focus on the beta receptors. You have beta 1 and beta 2. Beta 1 is circumscribed to the heart. Beta 2 is circumscribed to the lungs, liver, muscles, uterine smooth muscles. And here on the right, you have a beta blocker overview, and it still gives you a narrative on the beta receptor locations. It gives you a narrative on the mortality benefits of beta blocker for reduced ejection fraction heart failure. Here are the cardioselective beta blockers: metoprolol, atenolol, esmolol, and you have missed alpha and beta blocker agents, carvedilol and labetalol. And you have the non-selective beta blockers, propranolol and nadolol. Okay, this is a very short, concise review on beta blocker use for hypertension. Beta blockers are mainly used as additive therapy for resistant hypertension. Vasodilating beta blockers such as carvedilol and nebivolol have demonstrated positive endpoints in BP management. No research has been executed on long-term effects of singular use of beta blockers for hypertension management. Nebivolol augments endogenous production of endothelial nitric oxide, which aids in vasodilation. Nebivolol also carries a low risk of diabetes, and it's well tolerated in hypertensive patients. Atenolol, which is the most widely used beta blocker, and metoprolol provide minimal stroke protection compared with that rendered by ACE inhibitors, ARBs, calcium channel blockers, and diuretics. Adverse effects of beta blockers can worsen heart failure. Abrupt withdrawal can result in anginal episode and rebound hypertension. Can cause sinus node dysfunction, bradycardia, max hypoglycemia, cause bronchospasms, increases the risk of diabetes when given in conjunction with diuretics, can cause sedation. Side effects of beta blockers include the following: fatigue, nausea, dizziness, weight gain, and sexual dysfunction. There are other side effects. These are just a few of them. Thank you so much. Very short description of beta blocker use in hypertension. Beta blocker use is also patient specific. So it's important to also bear that in mind. But this is just an overview of how it's used in hypertension.